After diabetes, which by far is extremely common right now, the second most common consult every day of the week is some kind of thyroid disorder. There's no age that escapes thyroid disease. You can pretty much see it, young or old. People come to me saying, just put me on some thyroid hormone, thinking this is going to fix it all. It doesn't always happen. Overdo that iodine, it's going to hurt. Overdo your vegetables, it's going to hurt. If you have a bad day, go back, think about everything you put in your mouth.
Hello, everyone, and welcome to this super exciting episode on thyroid dysfunction. So, previously, we had our guest of today, Dr. Ashwini Gore, for a previous podcast, which was on diabetes, and she provided some amazing tips as to what we can do to manage diabetes. How do we even figure out whether people have diabetes or pre-diabetes? It was just an eye-opening podcast. So similarly, on popular demand, we have her back on this podcast for addressing very common issues that we see are increasing globally in thyroid dysfunction. So please welcome Dr. Ashwini Gore, who is a renowned endocrinologist at the Jones Center in Macon, Georgia, United States. Welcome back, Ashwini. The previous podcast was just amazing. Thank you so much.
Thank you so much for getting me back. Definitely my honor and pleasure to be here.
Yes, so we talked about how prevalent diabetes is in the previous podcast. But shockingly, we are hearing about many cases of thyroid, most commonly hypothyroidism. So there are many things that we are hearing. It's not just full blown hyperthyroidism or hypothyroidism, but just changes in different hormone levels. So for the uninitiated, we are talking about levels of T3, T4, TSH. So what is going on?
I would like to start with just a little introduction to the thyroid gland. Or even take a step back and say our bodies are pretty complex. And I had referred to this even in our diabetes talk. So, when we talk about glands in our body, there's two different kinds of glands, exocrine glands and endocrine glands. And simply put, a gland like a sweat gland, it produces sweat and it puts it out onto the skin. So it's done locally. That's an exocrine gland. Endocrine glands tend to be more, I would say, complicated. You have a gland that produces a substance called a hormone, and this hormone is then released into the bloodstream and it travels a long distance to various parts of the body to have its effect. So, the thyroid gland is one of the endocrine glands in the body. It's a butterfly shaped gland. It sits, you can really look at it as right in front of the throat. In men, it's easier to define the Adam's apple. But if you look at the Adam's apple and then go a little bit below it, it's nicely wrapped around the throat. So, this little butterfly shaped gland, 5 to 20 grams in weight, nothing much, but it can affect and control a lot of things in our body. Things we take for granted, our metabolic rate, how many calories we burn, how hot or cold we feel, how our heart moves, how our stomach moves, everything, how our skin looks. There's so many things that this little butterfly shaped gland affects in the body. That's your thyroid gland. So, to begin with, tiny gland produces hormone, stores hormone, and then dumps it out into the bloodstream to have different effects down the road. So, the hormones the thyroid gland produces are the thyroid hormones. And there are two hormones being produced, T4 and T3. Most of what our thyroid gland produces, almost 90%, is T4. T3 is the active hormone, but only 10% of T3 is produced by the thyroid gland. Whenever this hormone travels to different tissues, different organs in the body, whatever the body needs, it can then convert that T4 into T3 as and when it's needed. And and that's a little bit delving into thyroid hormone. Everything in our body is controlled by our master gland, which is the pituitary gland in the brain. And the pituitary gland in the brain is what sends down a signal called thyroid stimulating hormone, or TSH. And TSH regulates how much thyroid hormone is produced by the gland. It is also affected by how much thyroid hormone is produced by the gland, which means if the gland is working like it should, it sends a signal back to the brain, the TSH is okay. If the gland is not doing what it's supposed to, it changes the TSH signal from the brain. If the gland is working too hard, that changes the TSH signal from the brain. So, yes, when we talk about hormones, what I want you to understand is we have T3 and T4, which are actual thyroid hormones that are having effect in the body. TSH is also a signal receptor, it's also a hormone, but it is not what we consider thyroid hormone. It's the signal to regulate how much thyroid hormone your body produces.
So that was a very clear explanation. And you mentioned some very important points here that when we think about thyroid, we are not thinking about weight gain or the other things that are associated with thyroid dysfunction, especially for people who are looking to lose weight. People are not able to figure out why they are not losing weight. It could probably be that they are missing the thyroid hormone, or they are, they do have hypothyroidism, and that is something they do not test. So it is great that you mentioned it. But we are seeing a global rise in the number of thyroid cases. Even if I look around just without the actual numbers, it is so much more common to see some kind of a thyroid dysfunction. So, what is it that you are seeing in your clinic? Is it something that you saw maybe 20 years ago, or whatever you're seeing now? Are the numbers changing? Are people just being more aware, or has it actually changed?
So it's a combination. Yes, we do see a lot more thyroid conditions or disease at this time. Now, you have to take this with a grain of salt. I am an endocrinologist. This is what I do, which really means after diabetes, which by far is extremely common right now, the second most common consult that I see in the office every day of the week is some kind of thyroid disorder. It could be an underactive thyroid, which is more common. It could be overactive thyroids. It could be thyroid nodules and goiters, and it could be cancers and different kinds of thyroid cancers. So, overall, in general, yes, you will see a lot of thyroid disorder, definitely in an endocrine clinic, but even outside. As I mentioned previously, almost if I had to say thyroid disorders can be clubbed as somebody is making too much hormone or has an overactive thyroid, or making too little hormone and has an underactive thyroid, then 95% of thyroid disorders are due to an underactive thyroid. An overactive thyroid is usually rare. Under those headings, again, you can really look at different reasons why people develop underactive thyroids, depending on which part of the country or which part of the globe you live in. These disorders or the reasons for those disorders will change, but overall, you'll see a bigger incidence of an underactive thyroid. One other thing I would like to mention here, and we will go into detail maybe later, is thyroid disease is far more common in women as opposed to men. So you will see 5 to 6 times more women affected with thyroid disorders as compared to men.
That's a significant number. So, just going back to what you said, that there are geographical differences in how these thyroid disorders are seen. So, what are the most common reasons?
So if you asked me 30 years ago when I was a medical student, then iodine deficiency, especially doing medical school in India, iodine deficiency in endemic areas was probably the most common reason we saw thyroid disorders. If I look at my practice in the United States, I say two-thirds, almost 67% of my patients have an underactive thyroid because of an autoimmune condition. It is because of their own immune system playing havoc in the body. A lot of the world is now iodine sufficient. There are still places where iodine deficiency and goiters are very common, but most of the world, because we've started adding iodine to our salt uh, and other foods, is relatively iodine sufficient. What I see a lot more of right now is what I call autoimmune thyroid disease. And I really say nobody knows a true or a clear answer as to why this happens. But the more you search, the more you look, I think this gets us into our topic today. There is something that may be called a gut thyroid axis, and there may be some relation to that gut microbiome that's causing a bunch of these conditions that we see.
Yes, thank you so much for mentioning that. I was about to ask you that autoimmune diseases are much more common in people who have gut dysbiosis. When the immune system training does not happen or it happens in an improper way, autoimmune diseases are a lot more common. So, of course, the incidence that you are seeing of autoimmune thyroid disorders, which are the most common, could be linked. So there is not enough evidence for that, but that could be one of the big factors that gut dysbiosis could lead to any form of autoimmune disease.
That,
So that was a very, very important point. We always harp on that, that whenever there is gut dysbiosis, it is going to cause all of the other endocrine disorders that you might see, any of the metabolic disorders, the thyroid disorders. So even when we have iodine sufficiency, when we are getting enough of it from the salt that we are eating, if the gut health is poor, if the gut is dysbiotic, it can still lead to a lot of immune disorders or autoimmune disorders like the ones you are seeing right now. So do you also see this in children now, or is it only seen in adults, or has that changed more recently?
so honestly, you see thyroid disorders at every age and stage in life. More and more newborns are screened for thyroid disease. More pregnant women are screened for thyroid disease. So hopefully we are doing our part to screen, detect early, or potentially prevent certain issues from happening. I'm not a pediatrician, I'm not a pediatric endocrinologist, but my hope would be we don't have so many kids born with goiters or having complications. Yet as a rule or in general, autoimmune thyroid disease is just it's very common. You're going to see it. It doesn't matter what age group you're looking at. Now, I do say here when we start thinking of thyroid cancers, the general thought is the younger age group, if I diagnose them in their 18s and 20s, or the older age group, 70 years or older. Those are the two extremes of ages that I'm a little more worried about. I'm a little more worried about nodules or growths on the thyroid, which could be cancerous. Now, outside of that, I say pretty much at- there's no age that's, I guess, that escapes thyroid disease. You can pretty much see it young or old. I think it's just knowing about it, having other family members who are affected, being more aware, and having better tests that's leading to more diagnosis in general.
Okay, so I was not aware of thyroid screening for newborns. I'd never heard of that. But I mean, that's scary. That sounds scary that, we have to now look for thyroid dysfunction even in newborns.
I would say modern medicine is a beautiful thing. Now, sometimes it may be too much testing, but
Yes.
some good facts to know about the thyroid. Without going into too many details, we have a sperm and an egg that get together and form an embryo. And as that embryo starts to develop, that thyroid gland or the beginnings of the thyroid gland start to develop as early as 3 weeks. And by about 12 weeks of pregnancy, You have cells in that newborn embryo that are starting to work, starting to produce thyroid hormone. That thyroid hormone is critical to physical development, the development of a good brain and intelligence in a baby. So the honest answer is it's a tiny little gland producing a little bit or two small hormones, but they are extremely crucial. They're critical hormones. And the way I look at it as I'd rather find out day of birth if everything is good or is there something we need to follow, then wait for my baby is not growing. They're not gaining height. They are not as intelligent or not keeping up with their peers at school. So, on a good note, I do think we have simple, easy tests that can be used to screen. Once again, I say I'm working or I'm privileged to practice in a developed nation who can screen all their newborns at birth. I am not going to apply this as a worldwide technique that it is happening in every hospital in every part of the world. Uh, but we do have tests to screen as early as at birth.
Yes, you're absolutely right. The availability of this testing puts everybody at an advantage of finding out early enough to do something about it. And now that people are more and more aware about thyroid disorders, what are the signs that people should be looking at for young children or even adults? What are the first symptoms or signs that people should be looking at for any kind of thyroid disorder?
An easy way I like to describe the thyroid. Think about it as the energy generator of the body. So you have to think about your thyroid. So if that energy generator is not working, it's not making enough or it's not doing what it's supposed to do, everything seems to slow down. So if somebody suddenly starts noticing, whether it's a small child or whether it's older adults, you suddenly are more and more tired, you're sleeping more, you don't have the energy to get out of bed and do the things that you enjoyed doing. A doctor listens to your heartbeat and your heart is beating extremely slowly. You're not having a bowel movement every day. The gut is moving extremely slowly. Some people describe a very dry skin, almost like an alligator skin, as they call it. Uh, the hair starts looking very thin, very brittle, starts falling off. So, a generalized slowdown of all functions in the body could point to, it doesn't have to be, but it could point to a thyroid disorder. And a TSH check is in order at that point. Now, on that same note, if you looked at it the other way, the energy generator is working overtime, then think about everything feels wired out. This is a person who cannot go to sleep. They stay awake, they get anxious, they're panicky, their heart's beating too fast. They may have tremors or shakes. They may have diarrhea. Some people may not think about it as diarrhea, but every time they eat, they're going and having a bowel movement 5, 6, 7 times a day. So this is the stark opposite. I will also mention temperature changes here. A hypothyroid person or one who's underactive tends to be cold all the time. A hyperthyroid person tends to be hot and sweaty all the time. I say this with a grain of caution because think about it. All these symptoms that I'm talking about are extremely nonspecific. You could be stressed. You may have a bad day at work. You might have just a family member who's sick. And all of those can also affect how you eat, if you sleep, how you feel. But in general, if there's no other reasons to explain your symptoms, you're having a bunch of symptoms that feel like they could be related to the thyroid, then it's very reasonable to ask for a thyroid blood test.
Okay. So those were some, I mean, there are a lot of things that people can look out for. And we do see some people with obvious signs of thyroid, just like you said, slowing down. We do see some people talking in a very slow speed. And we have noticed that, whenever they test for thyroid, they have changes in their TSH level, T4 levels, or things like that. So it's good to watch out for these symptoms. And when people have these symptoms or when they begin to notice these, what are the things they can do to, stop this from progressing to a full blown autoimmune disease if it is caught early enough?
So, going to the testing, the general recommendation when you test somebody for the thyroid, the best screening test is a TSH, the thyroid stimulating hormone. So I told you, our brain kind of controls or knows what's going on with the rest of the body. So you have a lot of symptoms, you go to your doctor and your doctor tests a TSH. If that TSH is normal, then provided your brain is working right, which we hope it is, most of the time that's a good enough test to say you don't have a thyroid issue, you need to look at something else going on. Now, it could be that that TSH comes back abnormal. That's when your doctor is going to do more tests. That's when they're going to check for T4 and T3. As an endocrinologist, what I always do is check antibodies to the thyroid. So, as I'm checking those thyroid labs, I am checking to see if somebody's immune system is attacking the thyroid. And that's what's causing some of the symptoms that they're having. So, in general, your TSH and then an abnormal TSH leading to T3, T4, or antibody level testing is how you go about starting to diagnose what things look like. A clinical exam is very important. How that thyroid looks or feels also determines if I'm going to do more studies, if I'm going to order an ultrasound on the thyroid, and go further from there.
Okay. So when people do have thyroid dysfunction and when they are on medication, so they most likely need to take them lifelong. Like if we are talking about thyroxine, levothyroxine. So what are the most common side effects for it, and is it possible to do something without going on thyroxine? Is it possible to reverse thyroid? That's something that many people ask, and what are the things that can actually be reversed?
That's right. So, the way I look at it, going back to your screening test or a TSH, now different labs have different uh, upper or normal limits. But in general, the lab we tend to use, a TSH somewhere between zero point 0.5 to 5 is considered normal. Now, if your TSH falls above or below those limits, you're kind of looking at an over or underactive thyroid. Now, let's talk about those underactive thyroids first, just because it's far more common to see an underactive thyroid. Now, if your thyroid gland is not making enough hormone like it's supposed to, your TSH is going to be higher. It's going to go up. I know that's confusing, but I say if you have children at home, you'll understand this quite nicely. I say if my kids don't listen to me, they don't do what I'm telling them to do, I scream. Uh, so if your thyroid's not working, if it's not producing the hormone you need, then yes, your TSH is going to go up. Sometimes the first point where I find people is what I call subclinical hypothyroidism, which means the TSH, instead of 5, it's a 5.5 or a 6. It's gone up slightly, but their T4 and T3 levels are still normal. So the thyroid gland has figured something's going on. The gland is slowing down, but it hasn't completely slowed down. My preference at this point is dietary changes, looking at potential causes, and not treating that TSH. A lot of us want easy, quick fixes. People come to me saying, just put me in some thyroid hormone, thinking this is going to fix it all. It doesn't always happen. I might make you feel better for a couple of months, and then that TSH may go up again. You may need more medicine. So, if you are going to change something, if you are going to fix something, generally speaking, we need to find it early and do something about it before we start you on medication. Once somebody is on thyroid medicine, I'll say it's not impossible, but I've found it extremely rare for somebody to come off of those medicines in general. And then coming to thyroid hormone supplements. The most commonly used thyroid hormone medication is levothyroxine. Now, this is synthetic thyroid hormone. Uh, Anytime you synthesize something, you have to add fillers, you have to add dye, you have to add preservatives to make it into a pill. So I won't say people have side effects from the hormone. I say people have side effects from what else goes into that pill. And a lot of the side effects look exactly like the symptoms people were complaining of in the first place. So they could have hair loss, they can have skin changes, they can have itching. So a bunch of things or stomach issues that could also come from the thyroid. So if we are able to do something, detect it early and prevent getting on hormone, I think that's much easier than trying to withdraw hormone. Now, on the opposite end of the spectrum, I told you overactive thyroids are much less common. Overactive thyroids, interestingly, if they are autoimmune uh, in origin, I have seen that about 50% of people are able to take medicine for a couple of years and then slowly wean off that medication and potentially go into remission. So those are the people who may end up taking medicine for a year or two and never have to take it back again in their life. I will come back when we talk a little bit more about that gut microbiome. It does look like if that microbiome is not doing what it's supposed to do, then these people also now more frequently land up staying on medicine much longer or are not able to come off of the medicine or may come off of the medicine and then go back on it because of issues. So, prevention is the best strategy. Try not to get on meds if you can. Safety is important. If your TSH is 100, you're not making any hormone, you need to be on thyroid medicine. Uh, but anything else, we need to talk about what can be changed to maybe not need so much medicine.
Yes, absolutely. Now that you talked about the gut microbiome, some things I wanted to ask is when people have thyroid disorders like hypothyroidism, they're asked to stay off of vegetables like cruciferous vegetables, for example. So, why is that? What is happening? And if we encourage people to eat a diverse diet to improve their gut microbiome, and they have to cut out all of these foods so it becomes slightly difficult. So, just wanted some insights on what those do actually.
So I'm glad you brought up a beautiful question. So let me take a step back again. Whenever we start talking about thyroid hormone, we think about iodine. And iodine is an important trace element which is required to synthesize to make thyroid hormone. But iodine is not the only thing in the body that helps us produce or make enough good thyroid hormone. So, iodine is important. Selenium, zinc, iron, copper, vitamin D. There's a lot of trace elements in our body which are important to the function of that thyroid gland. A very simple way of looking at it. Iodine is one of those substances that's really only required by the thyroid gland in the body. We have multiple different, a complex enzyme system which helps you pick up iodine from food. And then the thyroid synthesizes a protein, a thyroglobulin, which sits in there. So that's kind of the precursor for thyroid hormone. And depending on these different trace elements that I mentioned, a lot of these iodine molecules are grouped together with protein, with that thyroglobulin. And now you have T3 with three iodine molecules, or T4 with four of those iodine molecules. And that thyroid hormone is then released into the gut. So if you look at it, there are a lot of things that need to function right for that thyroid hormone to be produced. Our body also has a very sophisticated set of enzymes which can break down uh, thyroid hormone, change it from T4 to T3. There are different, I would say, elements that cause inflammation or oxidation in the body. So that thyroid and its set of enzymes is a pretty complex system. Now, foods like the vegetables you mentioned, so cruciferous vegetables, cabbage, kale, broccoli. Brussels sprouts, rutabaga, bok choy, you name it. All of these vegetables do have certain substances called thiocyanates in them. And these may, if ingested in large amounts, these may break down some of that thyroid hormone. That's the simplest way I can explain it. The honest answer is you have to eat extreme amounts of these substances to cause damage in the body. So, moderation is key. No matter what you do in life, moderation is important. This is what I tell my patients. If you told me you're going on a cabbage soup diet and you're going to eat 5 or 6 cabbages every day, that's all you eat and nothing else. Yes, that is a problem. You're going to knock down that thyroid. Uh, but I eat one handful of cabbage or kale or cauliflower or broccoli or whatever it is, once or twice in a day or a few times a week, that's absolutely okay. You cannot do significant harm with any of these vegetables, but they are important vegetables and they do add to that beautiful gut microbiome that you have. So don't fear food of any kind, is my general recommendation. But everything that you do, do it in moderation. Now, here again, this is too complex a physiology to kind of explain in the little podcast. But let me just say this, that thyroid gland is complicated. I just told you it needs iodine to produce thyroid hormone. If you give it more iodine, the thyroid gland, at least for a little bit, is going to take up more and more and more iodine and make more hormone. You get greedy and you say, I want even more hormone. I'm going to give myself even more iodine. Guess what? There are mechanisms in place that suddenly just crash the whole gland, break it down, and don't allow it to take up or form any more hormone. And the gland is going to stay shut down until your body can clear that extra iodine. Everything comes back to normal, and then that effect is released. So there is no good thing. There's no perfectly safe element. There's no perfectly safe food. And I say the same for iodine too. People take iodine supplements. A very tiny amount may be helpful. We add iodine to salt to help thyroid function. Overdo that iodine, it's going to hurt. Overdo your vegetables, it's going to hurt. But everything in moderation, it is important, it is required for your thyroid hormone formation, function, and release.
That was a very important point because we do see this very commonly that people are avoiding cruciferous vegetables completely when they have a diagnosis of any kind of thyroid disorder. And the points that you made make complete sense that nobody is overdoing it and it is already in moderation. These are small amounts that they're consuming maybe once a week or not that frequently at all. So that was something very important that everybody needs to know. The other points I wanted to ask was what are the things that we need to do in order to prevent thyroid dysfunction? Because we are talking about the involvement of the gut microbiome and the health of the thyroid gland and how important it is, right? When a baby is in utero. So, what are the things that parents can do? What are the things that children can do in order to have a well functioning thyroid throughout life?
So, so let me put out two concepts here. Now, one, I just want you to understand we have something called the gut associated lymphatic tissue, or GALT, which really makes up about 70% of our immune system. So that's one thing. I'm just going to put it out there. A lot of our immune function is regulated by the gut and its lymphatic system. Now, coming to the thyroid, at the beginning of this talk, I told you at least two-thirds of the thyroid issues I see in my office are what I call autoimmune thyroid disease. So it's our own body, it's our own immune system. And the way I explain it to patients, it's a good immune system. It may be fighting coughs, colds, fevers, but it's a confused immune system. As it is attacking those coughs and colds and fevers, it recognizes certain proteins on your thyroid and says, this is the enemy, I need to attack it. So, a lot of issues in the thyroid are coming because of this autoimmunity. Now, here I will add or kind of separate. There is a condition called celiac disease in which people are allergic to gluten being a big protein that we ingest very commonly. It's part of multiple different foods in our body. Uh, but what we see in thyroid disorder is a similar gluten sensitivity. Not every person that I see has celiac disease, but they have gluten sensitivity similar to celiac. And we do think it's foods, it's irritants coming in through the gut every day. The gut attacks or the immune system is attacking those proteins. And as it's attacking those proteins, it's also attacking some of the proteins on the membranes of your thyroid. So, a simple or a not so simple way to look at it. If we can find those food triggers, if we can find the substances we are sensitive to and try an elimination strategy, then we could hopefully prevent some of that inflammation and oxidative damage that's happening. You'll see a lot of literature on gluten free diets, autoimmune protocol diets. Basically, to me, good journal keeping is one of the best things that you can do. Tend to think about bad things. I don't feel so good today. I feel bloated. I'm hurting. I'm cramping. I'm itching. If you have a bad day, go back, think about everything you put in your mouth food, drink, snack, whatever it is, write it down. Keep a close enough journal. You may come up with certain triggers. Hey, every time I eat this multigrain bread, I get a symptom. Every time I eat pizza, this is what happens. So if you can keep a journal of your symptoms and figure out your trigger, eliminating those triggers is going to help. I do say there's, as you keep a journal, you tend to forget good things. Don't forget good things either. If you feel especially good on a certain day, if you have a lot of energy, everything seems to work great. Also note that down because hey, that may be the food you need to consume more of. So yes, that's one way of going about, but an autoimmune protocol diet or a gluten-free diet, looking at a good resource, could help people with sensitivities to maybe get a handle on thyroid disease as well.
That was such a simple tip, and I'm sure it is going to be life changing for many people. I'm definitely going to use it because there are some days where I feel extremely energized and it's a completely different day. And just noting down what is working, what is not working can be so helpful. So, thank you so much for this amazing, amazing tip. So there are many, many things that are associated with thyroid. I'm just being greedy and asking a lot of questions. So when people have thyroid dysfunction, they also have a lot of other issues. Like we see that there's an increased incidence of infertility. There are other things that are also going on because the thyroid is not functioning that well. So just being on thyroxine, does that help with all of the other issues that are associated with thyroid dysfunction?
So again, thank you for a great question. Uh, no, the easy answer is no. Or going back to, if you relate a lot of the issues to the autoimmune component or the gut microbiome component, uh, levothyroxine can only fix hormone levels in the body. So if your TSH is abnormal and I give you medicine, I can fix your TSH. Now, if you had weight changes, diarrhea, or constipation, if you had certain physical symptoms because of that abnormal TSH, I can change it. But if your immune system is attacking your skin, your joints, your gut, you name which organ, then levothyroxine or any thyroid medicine for that matter cannot fix your immune system. So you have to look at your thyroid or your thyroid symptoms and issues as a composite of two different things. As an endocrinologist, my role is to one, fix your thyroid hormone levels to make sure you're getting adequate hormone, you're not making too much or too little, not getting too much or too little. The second component is to work on that immune system. And I know we talk about, or we are talking about that gut microbiome. Uh, as I mentioned, moderation is key. You don't want any excess of any substance. Food keeping or journal keeping is important just to have more good days than bad days. You want a wholesome, a healthy diet which will give you all those trace elements that are needed for good function. You have to keep your medical issues in mind. So, people may have had gastric bypass or gastric sleeve surgeries. They may have Crohn's or some other malabsorption disorders, and it may not be their thyroid. Their symptoms might be coming from not absorbing all the nourishment or the nutrients that they need on a day to day function. And then finally, I keep going back to this in every talk that I do. So, really, physical health and mental health are really tied in. So, a good, calm mind, meditation, stress release, it's also going to work or have some benefits towards calming down that immune system because your levothyroxine, your thyroid medicine is doing nothing for your immune system. It's only fixing a lab abnormality. It's only fixing hormone levels. There's a lot of other stuff in the body that you need to work on separately.
So thank you so much for the amazing insights about thyroid. We can go on for hours. I know that's very, very interesting. But what I like the most about getting this kind of information from you is the simple tips that people can use. It was the same for diabetes. These are so simple, so usable, so relatable that we can use right away and start feeling better immediately. So thank you so much for all of these. And we would definitely love to have more and more insights about a lot more things. So, thank you for being with us, Dr. Ashwini Gore. It was such a pleasure having you on the podcast.
Thank you again for having me. The pleasure was all mine.
So, viewers, I hope you have learned some really easy tips in managing your thyroid, in looking at what could have caused it. Isn't it interesting that anytime we talk about any disorder, it pretty much always goes back to the health of the microbiome, to the health of the gut microbiome, because it holds the key to what is going on in our body, whether it's inflammation, whether it's autoimmunity, where the body is reacting to itself. So while being on medication might help managing diseases, but we do have to go to the root cause of what is going on. Do look out for any signs or symptoms of disease, and you will find out what your body is trying to tell you. Stay tuned for more such interesting and amazing podcasts. Do like, share, and subscribe to our channel. See you in the next one.